If you look at question 6, it's about finding the sentence that defines the left ventricle outflow tract. As I explained in the previous lecture, the definitions related to this follow the standards of the American Society of Echocardiography. According to the American Society of Echocardiography, the correct answer for the left ventricle outflow tract is the content found in option number 10. So, the LVOT is defined as the area from the free edge of the anterior mitral valve to the aortic valve annulus. Let's also take a look at the related diagram. As you can see in the diagram, the section from the free edge of the anterior leaflet to the aortic valve annulus is considered the left ventricle outflow tract. It would be helpful to remember both the basic concept and the image together. Let's move on to the next question. This question asks you to select the option that is not related to the mitral valve apparatus. For those who have studied the basic theory, I think this question shouldn't be too difficult. The relevant options here are A, B, and D. The sinus of Valsalva can be explained as the option that is not related. Yes, as you can see in the diagram, the popliteal muscle is located here. The tendon located between the popliteal muscle and the annulus is called the caudal tendon. These three representative structures make up the mitral valve apparatus. In Korean, this can be referred to as an accessory structure. You can organize the content together with the diagram. Let's move on to the next topic. This question is asking about the area of a normal mitral valve. The correct answer is option B. Usually, an area of 4 to 6 square centimeters is considered the normal range. Let's look at the next question. This question is asking about anatomical structures related to the aorta. It is asking for the name of the section of the aorta located between the diaphragm and the iliac artery. Starting from just below the diaphragm and extending up to just before the iliac artery, this section is called the abdominal aorta. So the correct answer is option A. As you can see in the video, it starts from the aortic arch at the top and then branches out downward. The ascending and descending aorta are connected, and at the level of the diaphragm, it transitions into the abdominal aorta. Let's move on to the next question. This one is also related to the aorta. It's about choosing the option related to the branches from the aortic arch. In order, the right brachiocephalic artery branches off first. Next is the left common carotid, followed by the left subclavian. So you should select option number 10 as the correct answer. As you can see in the video, the aortic arch runs along, and the first branch is the innominate artery, or brachiocephalic artery. It branches off here, then the left carotid and left subclavian follow in order. Just remember this sequence. With this question, just make sure you have the basic concepts organized well. That wraps up solving this problem. Next time, we'll continue with the following questions. Alright, see you next time. Thank you.